The questions on the USMLE are designed to test your knowledge of the basic sciences and clinical medicine to evaluate your ability to think critically and solve problems. There are several different strategic methods expert USMLE test writers can implement to design a multiple-choice question. Gain awareness of these methods to help you become a grandmaster-level test taker. Conditional reasoning. USMLE questions often present a clinical scenario or patient case and ask the test taker to make a diagnosis or recommend a treatment based on the information given. This type of question presents a hypothetical scenario and asks the test taker to deduce a logical conclusion based on the information given. The answer choices typically include the correct conclusion as well as several plausible but incorrect conclusions. As the name suggests, you must make sure certain conditions are met before picking the right answer. Conditional reasoning questions often have the most bait information that's meant to disrupt your logical decision-making process and linear thinking. This is why it is so important to have strong foundational knowledge. If your foundational knowledge sucks, then commit yourself to watching the content on my channel. Then you know how to identify the bait information and answer choices that's meant to disrupt your thought pattern. Deductive reasoning. USMLE questions often present a set of symptoms or laboratory findings and ask the test taker to deduce the most likely diagnosis based on the information given. Deductive reasoning is a skill that you can practice in everyday life by coming to a solid decision solely based on the information that's presented to you. Exam writers may choose to disrupt your thought pattern by presenting a disorganized timeline of events, confounding lab values, or even an outlier symptom that doesn't really fit the picture in your main prediction. For example, many psych questions give you the weirdest freaking timeline. It's up to you to gather the information you've been presented and organize the timeline of events in a linear, antirospective method before deducing to your final prediction. Timing is crucial to gain insight on the entire situation. Inductive reasoning. USMLE questions often present a set of observations or examples and ask the test taker to make a generalization or prediction based on the information given. These are basically the short-style vignettes that are super vague NBME-styled questions that give you 3 to 4 pieces of information in which you have to come to your prediction. These are the you either know it or you don't type questions. So don't really waste too much time on these questions if you for sure have no idea what the fudge it should be. These questions could either be easy give me points or end up running your clock out. Analogical reasoning. USMLE questions often present a pair of similar or related patient cases or scenarios and ask the test taker to identify a second pair that is also similar or related. The answer choices typically include the correct pair as well as several plausible but incorrect pairs. These are pretty easy questions if you have some basic understanding of the physiology of diseases. The only way you'd get tricked by this type of question is if you're reading the question inaccurately due to shortage of time or fatigue. The vignette typically explains some random problem the patient is going through or some adverse effect of a drug they're experiencing, but the question will ask which of these processes are similar to what we just told you in the vignette. The point of this type of question isn't meant to trick you, but rather it's to test your understanding of disease processes and to see if you're able to connect the process to other similar mechanisms. Pretty common style for testing endocrine or physiological concepts. For example, they might explain a patient having vasospastic angina, but the question might ask which of these conditions present with a similar mechanism to this patient's current condition. If you're not paying attention, you might pick an answer that's pertaining to the vignette like atherosclerosis or MI. However, in reality, you should be picking something like Raynaud's phenomenon, which has a similar physiological cause as coronary vasospasms. Verbal reasoning. USMLE questions often present a short passage or statement that includes a logical error and ask the test taker to identify the error or to indicate that no error is present. The answer choices typically include the correct error as well as several plausible but incorrect errors. Hypothesis testing. USMLE questions often present a scientific or medical problem and ask the test taker to identify the best hypothesis or explanation based on the information given. Questions that use hypothesis testing often present a set of observations, data or findings and ask the test taker to identify the best explanation or hypothesis based on the information given. They may also present a clinical scenario and ask the test taker to identify the most likely diagnosis or treatment plan. Critical reasoning. USMLE questions often present an argument or a set of information and ask the test taker to evaluate the logic and soundness of the argument. Think ethics questions. Yuck. What's the most appropriate response by the physician type questions? These are annoying sometimes because all of the responses are something you'd never willingly want to say in clinical practice. However, as a general rule, be honest, minimize harm to the patient, maintain confidentiality, respect autonomy, don't fall into ultimatum or absolutism statements, and lastly, don't judge anyone. Categorical reasoning. This type of question presents a set of categories or classes and asks the test taker to determine which category or class a given statement or item belongs to. The answer choices typically include the correct category or class as well as several plausible but incorrect categories or classes. An example would be for pharmacologic questions. They might present a vignette that describes a patient receiving the current gold standard treatment for their illness, and the question may ask what class of drugs does this treatment belong to. If you got to this point, then I'm really proud of you for not being an average med student turd that sits around all day watching TikToks on their phone and sharing mind-numbing content with your friends. Help your friends become an above-average med student by sharing this video and subscribing to the channel. Drop a comment if you think I left out any other common styles or if you'd like to provide better examples. Peace out, bitches.